Thanks, everyone, and welcome to our webinar session today entitled Monsters, Myths, and Medical Conditions. I am Dr. Voma, the host of this webinar session. I am the host and the founder of Lab to Doctors. Lab to Doctors, like the name goes, is a global patient-facing platform where we hope for everyone to have access to professionals who design, develop, validate, and ensure the quality of lab results, whether you are in Africa, in the US, in Europe. If you have questions related to the lab, if you have concerns about your lab results, real humans, not Google, not ChatGPT. If you want to talk to real people who will give you real information, not information that was researched in 1984 but has been updated in 2026 and it's not available on ChatGPT, then you reach out to Lab to Doctors. Create an account and be sure that you are current with us so that we can meet your needs related to your lab results, lab tests, or anything, whether you're setting up a lab or anything. Our speaker for today is Dr. Brandy Gunsolus. Dr. Brandy Gunsolus holds a doctoral degree in clinical laboratory science from Rutgers University. Dr. Gunsolus currently manages pathology utilization, specimen referral, pathology finance, and is the pathology and laboratory liaison at WellStar MCG Health. She is also the DCLS Residency Program Director for WellStar Health System and contributes to professional committees, including ASCLS, Government Affairs, and ASCP, DCLS Board Examination Committees. Welcome, Dr. Brandy Gunsolus. I'll now pass it on to her so she can take on and begin with the webinar. Thank you.
Thank you so much. I am honored to be here today to be speaking on this fun topic. This is an interactive session, so I hope that you will at least play along in your head, and if you want to play along and put your answers in the chat, that is fantastic as well. So this is monsters, myths, or medical conditions. It's a favorite of mine. I do have nothing to disclose for this presentation. Our objectives to today, I'm going to identify at least one classic monster that is based on a medical condition. Should be able to describe some testing that may be done to discern these medical conditions, and also describe at least one myth that is based on a medical condition. Like I said, this is an interactive session. So as we go through the different monsters, you could say, and I'm just getting over the cold, the crud, whatever. So my voice is going in or out. Just bear with me here. But this is an interactive session. So the possible answers are real, fake, or based in some truth. All right, so our first one, the bearded lady. So is the bearded lady real, fake, or based in some truth? I got a picture of, Letty Lutz from The Greatest Showman, great movie. So I got some responses here. Based in some truth, fake, real. So let's see, what is it? Bearded lady is real. So the bearded lady is a condition that's called hirsutism, and this is actually a hormonal condition. It causes the growth of this coarse, dark hair in females. It's typically, down here on the chin. You get the, dark, but it can also be, around the lip area. It can be, all through the cheek area. It can also be on the chest and even on the back. And you can even see it on the abdomen as well sometimes. It is very much associated with polycystic ovarian syndrome. I do see the chat, what causes it in 60 plus year olds? It is, and it's hormonal. It's the changes in the hormones. So in the 60 plus year olds, you're going through that menopause change, and that is where the hormones fluctuate, and you do end up getting where the estrogen drops significantly and the other hormones, such as testosterone, get a little bit higher. So you end up with that growth there. So testing, typically we don't do testing for this. You can, in severe cases, measure testosterone levels to determine the best treatment plan, but this is really only done in severe cases. There are some treatments that can be anti-androgens, and this is to combat those very high testosterone levels. But most of the time, the treatment is, just hair removal, either by shaving, waxing, electrolysis, lasers, creams, things like that. So what was the first documented case of this? The first, well, this has probably been going on for many, many centuries. The first actual documented case report of a full bearded woman was described in Charmousy, France, Clementine Delay, and by all accounts, she actually developed this at a very, very early age, but she frequently shaved. And it wasn't until after she married in 1885 and visited a carnival in 1900 that she saw a woman with, quote, an unimpressive stubble, and boasted that she could grow a better beard herself. And so her husband actually bet the carnival 500 francs, and they won the bet. And so they used the money that they won and actually opened up a cafe. And that cafe is Le Café de la Femme à Barbe. It's the cafe of the bearded woman. And this is a picture of her. So that's the first true documented case report, full case report of a bearded woman. Next monster, werewolves. So do you think werewolves are real, fake, or based in some truth? It's just a picture of a werewolf. I'm sorry if you're not seeing it. Fake, fake, fake. Oh, some truth, fake. Let's see. Based in some truth. So werewolves are based off of hypertrichosis. Hypertrichosis is the excess growth of hair, and there's actually many different types of hypertrichosis. There's a chromosomal, which is, there's several different genetic ones. There's a chromosomal X-linked, and those are your sex chromosomes. There's autosomal dominant, autosomal recessive. So autosomal dominant, those are those chromosomes that they always get passed down. The recessive ones are the ones that they kind of skip generations. And then paraneoplastic it's associated with cancers. So I'm going to show some pictures through here. Chromosomal hypertrichosis is what's called partial trisomy 3q. These are very, very rare. These babies often die in infancy, and they tend to have their foreheads covered in thick hair, and most of their head, and actually it does also go down their back quite a bit of really, really thick hair. And this is chromosomal hypertrichosis. But it, excuse me, it is generally incompatible with extensive life, and they do often die in infancy. X-linked hypertrichosis, this is generalized, and it's all over the body. They also could present with what's called chondrodysplasia, which is a skeletal malformation. So they end up with arms and legs that don't appear normal. They appear to be kind of bent in different ways, and they also can appear much shorter in stature. So, kind of giving this idea of the werewolf, that more wolf-like between the hair and the changes in the skeletal structure. But these are pictures of what X-linked hypertrichosis is. The hair tends to be a little bit curlier, but it is very thick and it is all over the body. Autosomal dominant hypertrichosis is also called Cantu syndrome, and this is where it's passed down to you'll see every individual in the family has this. And if you look, and here's a picture of siblings with Cantu syndrome, and you see that this hair presentation is very different from the X-linked hypertrichosis presentation. And this is a mutation in one particular gene, ABCC9. They also typically have what's called macrocephaly, which is a little bit larger head. Typically also have scoliosis, which is a bending of the spine. And they tend to also have some heart defects. Congenital hypertrichosis languinosa, and you see that the hair is also different again. So languinosa is that really fine hair that newborn babies have that tends to fall out shortly after birth. And then your regular hair will start to come in. But in congenital hypertrichosis languinosa, that really fine newborn hair never falls out. And it actually continues to grow and grow and grow. And it does this over the entire body. And so you end up with this really, really fine hair, just like newborn hair. And you can see that the hair texture is much different from that of Cantu syndrome or of X-linked hypertrichosis. This is very rare, incidence 1 in 1 billion. So far, we have not identified the gene responsible for this, but we do know that it does occur. And then there's acquired hypertrichosis, and this is the one that's associated with specific cancers. There's very few cases. There's only been 46 cases worldwide that have been reported, so this is exceedingly rare. And predominantly in females, when it's seen in men, it's only been seen in those with lung cancer. Females, it's been colorectal cancer, lung cancer, and breast cancer. And you can see in this picture that what happens is that they tend to just get this excess growth, and it tends to be on the face and on the ears as well. But it's just this overgrowth of hair. It's hypothesized that this cytokines, which are part of the immune system, just start overproducing, and it's triggered by the tumor cells to activate the hair follicles to just go kind of nuts. But because there's only been 46 cases worldwide, there's been very little research into what causes this acquired hypertrichosis. We're going to go to the next monster, so leprechauns. So do you think leprechauns are real, fake, or based in some truth? We got a fake. We think leprechauns are real. Ooh, we got a real. Do we think they're fake, real, or based in some truth? Got some based in some truth. Let's see. Perhaps based in some truth. So leprechaunism is also known as Donahue syndrome. And these are infants that are born that look much, much older than they actually are. This is where we believe that the folk tale of leprechauns actually came from. These are all newborns in these pictures. And you can see that as a newborn, they look much, much older than an actual newborn. They tend to have low set ears, flaring nostrils. Unfortunately, this syndrome is 100% fatal by 24 months old. They also have some excessive hair growth on the head. We have identified that it's caused by a mutation in the INSR gene. They also have 100% insulin resistance, so they're all diabetic as well. But this is where it's believed that the myth of the leprechaun originated from, are these very, very, small individuals that look much, much older than they should. And now, as far as, the pot of gold at the end of the rainbow and the leprechaun, I don't think there's much medical basis for that. I haven't heard of any doctor finding a pot of gold at the end of the rainbow yet, but we'll see. But as far as leprechaunism, that is thought to come from Donahue syndrome. Zombies. Do we think zombies are real, fake, or based in some truth? We got based in some truth, based in some truth, based in some truth. The zombies. Everybody's heard of it. Oh no, we got a zombie apocalypse. Could this potentially be real? Are they real? Let's see, fake, fake. Let's see. What is... They are fake. Sorry. No zombie apocalypse. All right, so the myth of the zombies, the myth of the undead. Oh, I'm sorry, James. I know. Crying tears. The myth of the undead actually started in South Louisiana, the U.S., by Haitian slaves. The rest of the world buries their dead in the ground. The problem is that when you bury your dead in the ground in southern Louisiana, the water table is so high that they would do this, and then the bodies would actually begin to rise out of the ground. And it's because the water table is so high that the bodies would start to rise up. And so this is where the myth of the undead, that these bodies are rising from the dead. And so this is a picture of what most people would think of a graveyard on the left, and on the right is a picture of a graveyard from New Orleans. And this is what they are today. And all of these cemeteries are actually in crypts, where you have to bury the dead above ground in crypts. Because if you try to bury them in the ground, they will actually rise back up out of the ground. Yeah, kind of interesting there where these mythologies come from. I don't know about Haitian drugged slaves. I don't know anything about. I'll have to look that up. Interesting. Now, there was thought that zombies and bath salts might have had a connection, because back in 2012, there was a case in Miami, Florida, where a gentleman named Rudy Eugene was found by police eating the face of a man named Ronald Popo on the side of a very busy causeway. It was a busy interstate. He had actually eaten 75% of the victim's face off by the time they were able to stop him. It took them shooting him 4 times to get him to stop. And he ultimately ended up dying from his wounds. Police initially published that they thought bath salts were the cause of it, and so there was this whole thing that, oh my gosh, bath salts cause zombies. They cause cannibalism. Um, did Ronald Papa? Yes, he did. Uh, so bath salts, for those of you that don't know what bath salts are, they are a designer drug. They are kind of a home cooked. They can be a combination of different medications, but they're home cooked stuff, and then they are packaged and sold as like things that you would put in your bath water to make it smell good. It's but they're typically sold at like gas stations and convenience stores, and they have on there it says not for human consumption. But why would you buy something to put in your bath water to make you relax from a gas station? I don't know. But that's what bath salts are. But people actually like smoke them and ingest them and snort them and do all kinds of weird things with them. In this particular case, they did not find any drugs other than marijuana in Rudy Eugene's system. And so they did not find a link between bath salts and the zombies, at least not at that time. Granted, this was in 2012. Testing has definitely improved since 2012. So maybe if we were to test those things now, we might find something. Don't know. I don't even know if we could get samples from 2012 from that case. I'm not even sure if they would even have them anymore. But there has been studies done on marijuana, and there actually has been between marijuana and cannibalism, and there's no link between marijuana and cannibalism. So you can, I'm not saying go smoke marijuana, but there's no link between marijuana and cannibalism. So people that smoke marijuana have no fear of becoming cannibals. There are parasites, though, that can induce zombie-like events. There is a fungus called, and I'm going to butcher this bad, Ophiocordyceps that infects different insects, like mainly ants. And this fungus just completely overtakes the ant so that it continues to walk, spreading the spores to other ant colonies. The ant's completely dead. It's just a shell, but it sends the chemical signals to continue to make the ant walk. Kind of creepy. There are also things called nematomorphs, commonly called the horsehair worm, that infects crickets and grasshoppers. Well, it will fill their entire cavity. Kind of does the same thing. It will make them walk to other crickets and grasshoppers to infect the entire colony. The cricket and grasshopper is completely dead. So it's kind of like a zombie. It's infected them and is making them do things against their will. And then there's cordyceps fungi that infects all different kinds of insects. Ants, butterflies, beetles, moths, bees. They really love the flying ones, because what this fungus does is not only does it infect them, but then it makes them fly up way, way high and then makes them self-combust and just burst to spread their spores everywhere. Dr. Chesie, you got a question.
Yes, not quite a question. I was just going to let the audiences know that they can post any questions they have in the chat window, because it's a lot of new content. It's a lot of things you're presenting here, and It may be by the time you're done with presenting, they may not be able to remember all the questions they had. So please post your questions while we wait. Thank you.
Oh, absolutely. Put those questions in the chat. Please do. So the good thing is about these fungi and the horsehair worm, there's no documented cases of human infection yet. I'm just going to leave it there. Yeah. So in microbiology, things will find a way. They're constantly, life evolves, especially when it comes to fungi. Uh, it mutates, it changes. And if humans become immunocompromised enough and we eat and our food is exposed to these insects, there is always a possibility. While there's no documented case reports of it, there's always a possibility that we could become infected one day with one of these fungi. All right, we're going to go on to the next monster. Serpent people. Do we think these are real, fake, or based in some truth? Oh, I got some fakes. Got lots of fakes coming in. Fake, 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 fake. Let's see. Based in some truth. So this is actually based off of a condition called ichthyosis vulgaris. Same as lizard people. Yes, yes. Ichthyosis vulgaris can be either acquired or congenital. There's actually 20 different variations of this condition, and it makes this really thick and scaly skin. And I've got some pictures here of it. It can be localized to, just the legs, or it can be over the entire body. It depends if it was acquired or if it was congenital, meaning that they were born with it. And so, yeah, it's kind of like lizard people, snake people. It kind of gives that same texture, very dry, scaled skin. But yes, ichthyosis vulgaris. The most severe form is called harlequin ichthyosis. Is a genetic disorder from the mutation in the ABCA12 gene. It is autosomal recessive, which means, you got to have two individuals that both carry the gene that happen to have a child. In this particular condition, it prevents the lipids from attaching to the epidermis. So your skin is primarily made of lipids or fats. Problem is, if those lipids or fats can't attach to the skin, you don't really have much skin. This is 98% fatal at birth, and those that do survive do not survive very long because essentially you're born without skin. Okay, we are going to move to the next monster, which is an ogre. You think, yeah, I do have a picture of Shrek on here, yeah. But do we think these are real, fake, or based in some truth? Got a fake, we got based in some truth, based in some truth, fake, based in some truth, fake. Let's see. They're real. Oh my gosh. Well, not the Shrek version. They're not green and they don't have, trumpet-like ears. However, ogre is actually acromegaly, aka gigantism. Acromegaly is a hormonal disorder where the pituitary gland just produces way too much human growth hormone. And so they end up growing and growing and growing and growing. Um, The way this is diagnosed is by the measurement of human growth hormone after puberty has been completed. You can also measure IGF-1 levels to determine, is this uh, acromegaly that's being caused by a genetic mutation, or is it being caused by a pituitary adenoma? So like an actual um, tumor that's on the pituitary gland, making it produce too much human growth hormone. And so those are the two different ways that you can get this condition. If it's a pituitary adenoma, they can always remove the adenoma and stop the excessive growth. If it's the genetic mutation, there's no cure for that. It's congenital, you've been born with it. So I do have some of the more famous pictures of acromegaly here on the screen. Dr. Chesie, did you have a question?
Yes, I was going to ask that if these things actually existed, so many years ago, how were these people identified? How were these diseases diagnosed, and how were they identified and treated? Was there any treatment for some? Most likely, not all of them are treatable, but just knowing what is going on with you is a sign of relief somehow, that people are aware of what you're suffering from. But what did it look like so many years ago, when the lab industry was not what it is today, with all the genetic testing that we do?
So prior to the 1850s, unfortunately, a lot of these individuals were just left to die. They were considered a burden on the family. They were considered a burden on society. They did require some specialized medical treatment. And so they were just left to die. Around the mid to late 1800s, those individuals that survived childhood, they were either institutionalized or they actually found their way into carnivals to make a living. It really wasn't until around the 1950s, 1960s or so, did we actually start to treat these individuals and start looking into these different conditions. And many of these conditions didn't really get the attention they deserved until even as far as the 1990s or early 2000s. So it's been very challenging for them with the advancements in genetic technology, being able to diagnose a lot of these conditions, whether it's just really just come about in the last 25, 30 years. Getting to know, why this happened, that this was a genetic thing, that this was passed down in the family, that you know I didn't do something that caused this, or that if you take acromegaly, that there's an adenoma, there's a tumor on the pituitary that is causing this. Being able to identify a lot of that, because prior to the last 50 years, they didn't identify those pituitary adenomas until the individual was already dead. And so it was a post-mortem identification. So it's very validating. It can be very good for mental health, being able to identify a lot of these conditions, and being able to identify them correctly and diagnose them correctly can also help with the correct treatment plan. So is it hereditary? Acromegaly can be hereditary with a mutation in the PTTG gene, or it can be caused by a pituitary adenoma. So it can be both.
Thank you.
Oh, thank you. Okay, going to the next one, Thumbelina. So do you think Thumbelina is real, fake, or based in some truth? So we got based in some truth, real, based in some truth, real. Let's see. It's real. So very much like the acromegaly, Thumbelina is primordial dwarfism. There's actually a group of disorders that fall into this. Shekel syndrome, Silver-Russell syndrome. I'm going to butcher this. Microcephalic osteodysplastic primordial dwarfism types 1, 2, and 3. Meyer-Gorlin syndrome. Because this is so rare, they have not identified all the genes that are associated with these. They have identified some ORC1 mutations, but these two girls here, the one in the purple, when this picture was taken, I believe she was 16 years old. And the lady in the red, I want to say she's 27 or 28 years old. So very, very, very small. And this is where the folklore, the myth of Thumbelina came from. Elves. Do we think elves? Let's see. Oh, are they normal mentally? Yes, they are normal mentally. And yes, she is the shortest in the world. Elves, are they real, fake, or based in some truth? We got real, based in truth, real, real, based in some truth, fake. They are based in some truth. So elves is thought to come from Williams syndrome. English mythology has elves described as portrayed as a child with a large, wide mouth, a small chin, and generally full of joy. Williams syndrome is described as a large, wide mouth, often with widely spaced teeth, an underdeveloped chin, a short nose, a very happy disposition, and an outgoing personality. And here are two pictures of Williams syndrome. One of them you may know very, very well from Stranger Things, but it is caused by a deletion of 27 genes on the long arm of chromosome 7. This is typically a spontaneous mutation. It is not generally inherited, but they have found a couple of families where it has been dominantly inherited, but it's usually a spontaneous mutation. Let's see, any of these condition elves look more likely in some countries like Ireland. So because these conditions are super rare, there hasn't been much study, or I should say there hasn't been much publication as far as whether or not they're more predominant in one locale or another. I will say that when you start looking at folklore and legends, when you find them in one area, you'll find a similar folklore or legend by a different name somewhere else. So you'll find it's just called something different somewhere else in the world. So whether or not like the elves or the leprechauns are predominantly a Northern European Caucasian based, or is it truly found worldwide? I don't know. I don't know. There hasn't really been much publication about it, but that would be interesting to actually see if it is a predominantly Caucasian or Northern European ancestry based thing. But there's no mental defects with these. It's all cosmetic, but they do tend to have a very happy disposition. Cyclops. Do you think Cyclops are real, fake, or based in some truth? Fake, 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 fake. Got lots of fakes. Oh, somebody said based in some truth. Somebody's got real. Let's see. They are real. All right, got some pictures coming up. So Cyclops is also called cyclopia, which is where you've got the fusion of both eyes on the face. And when that also happens, you have what's called holoproencephalopathy, and the nasal cavity actually kind of disappears. It all fuses together. You end up with a baby that has microcephaly, so a very small head, a cleft palate, the absence of the nose. The longest documented survival is 13 hours post-birth. This is not when you have the severe form with just the single eye. That is the longest documented survival. Now, there are various stages of holoprocin. I am butchering that name. Holoprocin. You know what? I'm just not even going to say it anymore. HPE. And you can see the various stages here, with A being the most severe, B being slightly less. You can see the nose has started to fuse. C, they primarily just have the cleft palate, a little bit of nose fusion. And then D is there, it has started to come together, and there is some fusion in the nasal cavity, but this, in D, it is survivable. It is a concurrent mutation in the SHH and the SIX3 gene. But yes, this is real. And if they have the actual full-on cyclopia, severe form, they do not survive. Okay, we're going to go to the Wendigo. Is this real, fake, or based in some truth? Based in some truth, real, real, real. Y'all probably have no idea what to think at this point. So let's see. What is the Wendigo? Yeah, no idea exactly. The Wendigo is fake. There's no Wendigos out there. Okay, there is something called Wendigo psychosis, and this is characterized by an intense craving for human flesh or an intense fear of becoming a cannibal. It is very culture specific. It's a psychiatric disorder that is in among the Native American Indians in Canada. It's got a lot of paranoia, anxiety, hallucinations, but that is Wendigo psychosis. It's not actually a Wendigo. Yeah, Cyclops can be ID'd in this in a sonogram. Yeah, but they have to be far enough along in order to identify it. That is true. Saw that in the chat. All right. We got just a couple more left. The mermaid or merman. Real, fake, or based in some truth? Real, based in some truth? Real, real. Based in some truth. So mermaid or merman is also known as cyrenomyelia, or mermaid syndrome. And this is a congenital fusion of the lower limbs. It has a higher incidence in mothers with uncontrolled diabetes and drug use during the first trimester. Not marijuana, but this is typically other types of drug use, when you're looking at those pharmacological agents that say can cause congenital malformations, this is one of those congenital malformations that unfortunately uh, can potentially occur. Um, it is not a condition that is inherited, as far as it's not passed down from generation to generation. This is spontaneous that occurs. Most of these individuals are missing any external identifiable genitalia, and the majority of them do die within a few days because they're also missing. They require surgery within the first day after birth because they are essentially missing any way to expel waste. So they do have to have surgery to create urethra and colostomy for an anus. But there was one that lived up to be 27 years old. So it is manageable with the correct medical therapies, but that is only because of modern day medicine. The satyr, real, fake, or based in some truth? What do we think? Real, based in some truth, fake, fake, fake. The satyr is fake. So satyr is actually a goat condition. It's not a human condition. This is a genetic condition in goats where they are born with a humanoid face. And so here are some pictures here. And yes, even goats can become cyclops. Last one, the good old vampires. So vampires, are they real, fake, or based in some truth? Yeah, based in some truth, based in some truth, fake, based in some truth. Maybe real, but they do not change into bats. They are not immortal, and they definitely don't sparkle. Sorry, got to put the Twilight reference in there. So there's multiple conditions that have been linked to vampirism. And I'm just going to touch on three real quick. One is porphyria, there's rabies, and there's tuberculosis. So porphyria is probably the one that has the most commonality with vampirism because they are sensitive to sunlight, very pale skin. They have these protruding teeth, kind of look like fangs. They also have aversion to garlic. There's several different types of porphyria. They can be born with it. It can be acquired. Do they really suck blood? So the initial therapy for porphyria back in olden days was to drink animal blood.
Mm.
Hence, there was this where the vampire mythology kind of came from. Now, were they called vampires then? No, that didn't come about until Bram Stoker, you know, the the book came out. That's what actually, you know, coined the term vampire. But porphyria, and as far as why the garlic aversion, I'm not really sure. I'm not really sure. It's just been documented that they do have an aversion to garlic. But this is probably the condition that is most closely aligned with vampirism. As far as testing for porphyria, there is what's called urine porphobilinogen, urine plasma and stool porphyrins, urine aminolevulinic acid or an ALA, RBC or red blood cell I can't talk today and I apologize. ALAD, And then those are abnormal, you would do genetic testing for a final differentiation of porphyria type between whether it was acquired or if it was congenital. You do need to rule out some of the more common causes of some of these, of the pale and anemias and so forth. And so you would do lead levels to rule out lead poisoning, much more common because, especially with lead paint, you get in older homes, you get exposures to lead in kids that way. And then urine organic acids to rule out hereditary tyrosinemia, which is a much more common condition than porphyria. Rabies, contracted through bites from bats. Bats is the most prevalent one that carries rabies, but you can also get it through dogs, foxes, and raccoons. Causes anxiety, confusion, agitation, light sensitivity, hydrophobia from water, hallucinations. There's only been one documented survivor from rabies, so stay away from any animals that look rabid and don't pick up downed bats. Tuberculosis has also been associated with vampirism, mainly because in later stages of tuberculosis, as they're coughing up, they cough up blood, and so they get the little, stained blood around their lips, and oh my God, they've been drinking blood. And they also tend to have no appetite, they're pale, and they have weight loss, and so that's where tuberculosis is on the rise in the US. It's always kind of been a problem in other areas of the world, but that's where the association between tuberculosis and vampirism. So I hope you've enjoyed this presentation of monsters, myths, and medical conditions, and many of the monsters that we see today and other humanoid-based mythological creatures are based on different medical conditions. They've been embellished through different lore throughout time, and more research definitely needs to be done in order to identify the genetic causes for several of these. Got a bunch of references, and I will take any questions if we got any time for them.
Any questions? You can come off mic and ask your questions. Any questions? If there are no questions, maybe I would ask a question. So let's see. Meanwhile, if you have a question to ask, please go ahead. Feel free. Do not wait for me.
Oh, I see a question. How is the TB resistance going? So I don't have current data. The last data that I personally have is about a year old, and it is growing. It's in different pockets though. I probably, not probably, I should, shame on me. I should pull the most current data to see where the spread is. My specialty is chemistry and immunology, so I don't keep up with the TB resistance as much as I should. I leave that to my micro counterpart. But yeah, it's as of last year, it was spreading quite a bit. Yeah. Oh, thank you.
So I have a question. What does a normal day in the lab look like when a truly rare condition, say something with only 46 reported cases worldwide, comes across your desk? What does it look like as a lab professional?
So when I get a test order for something that is really, really, really rare, the first thing that I'm going to do is actually look at the patient's chart, because if it's something that is exceedingly rare, chances are it's the wrong test order. And when I'm looking at the chart, I would say 9 times out of 10, they're not ordering the correct test, or they're ordering a test that's old. It's an obsolete test. It's something, I think, I remember reading about this condition in med school, And this was the test that we did for it. That was the test that you did for it back in the 90s. It's not the test that we do for it now. And so for a lot of those, I go through the chart and I'm like, I have to contact the physician and go, okay, this is the correct test that we need to do now. Um, and it's not that it's intentional. It's just that these conditions are super, super rare. And there's just not a lot of information that is really widely published about them. It's just not. And the more that we can reach out and be available to physicians to help with, guiding what the current testing practices are. I mean, it's hard being a physician in today's practices, trying to keep up with the latest in treatment, the latest in diagnostics, and if you're in the US, the latest in insurance coverage. What will insurance pay for and what it won't pay for, because it changes daily. Trying to keep up with what tests are out there on the market and which one is better and which one tests for this, and well, this one doesn't even available anymore. It is hard. It is
That's right.
hard.
That's right.
So pharmacy, they stepped up about 15, 20 years ago and said, hey, pharmacists, we get it. There's a lot out there and it's changing daily. We're here to help. And laboratory, we're now going, it's changing daily. We're here to help. And so, individuals like Dr. Chesie and myself, we're here to help our colleagues out. You got a question and you're not sure as to, what do I do with this? What's the right test? Or I ordered a test and I got a funky result. What do I do? Is this right? How do I interpret this within my patient? Or I'm a patient and I think I might have this. What test should I recommend to my physician? That's what we're here for. We're here to help you out.
Yeah, thanks, Dr. Brandy. I see there are a lot of questions in the chat window, and we're really running out of time. I would ask that these questions be sent to us and via the email. Let's see. Mary, please, can you post the email link so that they can send these questions directly to us? That way we can move on to the next phase of the presentation. Just send your questions to us and we'll answer them. That's why we have Lab to Doctors, that we create awareness of the lab, what the lab can do, and to let you know that you need to trust your instinct. And sometimes it may take a lot of tests to rule out certain conditions before we zoom into the real situation. So just know that the lab is out there for this kind of reasons, but that because you may not have access to a lab or lab professionals like us, if you go to the platform labtodoctors.com, send an email to this address, register, you'll be able to get to us and would answer your specific questions. So at this right now, I want to thank Dr. Brandy for this brilliant presentation that has raised awareness of rare diseases that so many of us are unaware of. We are usually blessed to have babies who do not have these situations, and we do not know what other people are experiencing. And sometimes the experiences may even be more difficult because of cultural differences. But I want to let each and every one of us know that you should trust your instinct. If you think something is different, reach out. If you cannot find a doctor, if you cannot find a professional, reach out to Lab to Doctors and we shall do the investigation and research for you and get to the bottom of it so that you actually know what you're dealing with. Thanks, Dr. Brandy. And at this point in time, I also want to thank the attendees for joining us on this webinar. Following the webinar from last month, as part of the survey, we would like to announce the names of those who submitted verification information within the allocated time. Those who actually won because they submitted the information showing that they participated in the survey. Please, you have to indicate if you are here when I call your name. And at the end of the week, we'll get to you, we'll get the prizes to you. You either indicate by hands up, or you get off mic and say, I'm here, or just drop a note in the chat window. I'm about to call your names now. David, please, if I don't pronounce your name rightly, forgive me. David Ajibade, Williams Wilfred, Penny Hemsworth, James Harvey, Thomas Brown, Michael Smith, and Thomas Johnson.
Yep, they're all here.
Okay, great. So you will hear from us by the end of the week on how to get your prizes, okay? Thank you so much for participating in our survey. It has informed us, and just so all of you know, likewise, besides consulting and providing lab-based information, we also provide continuing education for healthcare professionals who do not work in the lab. We also provide continuing education for professionals who work in the lab. If you never worked in the lab and you're interested in a career in lab medicine, reach out to Lab to Doctors. Would enable you bridge that gap, would enable you walk into a lab as if you went to a med tech school when you actually did not. So there's also the education component of Lab to Doctors that I would like for all of you to be aware of. Check the link, register, and so that you can stay up to date with the upcoming information on our platform. Thank you and have a wonderful rest of your day.